Great. So I'm sitting here with David Smallwood, who has agreed to have a conversation with us about what he and 140 do. David, it's great to see you, and thanks for coming along to talk to us.
You're welcome.
We've known each other for a while, and we've worked together on different things. What is it about 140 that makes 140 work?
I think our uniqueness in how we approach the problem. Lots and lots of people have been doing treatment for drugs and alcohol for forever. A long time, almost from the inception of Alcoholics Anonymous. But what we've brought to the table is the ability to look at not just the addiction and detoxification from that, and looking at a 12-step program, which is the conventional sort of way of dealing with the illness, but also then to look at the sensitivity underneath that and the trauma that brings to a child in early life, and actually means that that child starts using any substance or process to medicate their distress, which leads to addiction.
I mean, it fascinates me that we have this process where we can help the addicted person, but you know, I know that the family behind them also need that help and support. I know 140 have a great program, but perhaps you could talk to us about that.
It's a family illness. This it never ever just affects one person. I think probably for every addict there are 10 people who have the effects of that addiction, whether that's friends or work colleagues or immediate family, and it can be very debilitating. The bit that most people don't think about is that at least an addict has medication to suppress their feelings. The family don't. They have the full brunt of this without anything to help them deal with the pain. So they quite often end up as ill as the patient. And I think that if you have a good treatment process, to ignore the families is ridiculous, because you don't get good outcomes. The outcomes we know are better for people who are treatment centres who include their family in the process. And to that end, we have a family programme running at 140. We hope to extend it, but at this moment in time it happens every week in Harley Street, and it's free of charge for people who have someone in their life that's suffering from an addictive process.
And I know the experience of going there is a fantastic experience. One of the things that I love about what 140 doing is becoming a little bit more understood here, is this idea of the trauma-based addiction and the underlying problems of trauma. I know we've both worked with the same people, and we've worked with trauma quite a bit. We're very sensitive and have an understanding of trauma, and I know you guys have this great trauma program, and I'd like you to just spend a couple of minutes talking about how that works.
Okay. Some time ago I was running a treatment centre, and one of the things that I've always noticed during the course of my job as a manager or therapist is that there was a lot of relapse. And that's not because people didn't take on board the process of recovery. It's just that something seemed to completely cut through their recovery and cause them to use. And you know, it certainly wasn't willpower, because I think lots and lots of addicts have lots of willpower. So I investigated, and along with a couple of people that I worked with, we looked at the peer melody model of trauma reduction. And I went out to the States with some friends, and we looked and we trained with peer melody, and it became very obvious very quickly that actually the key to relapse prevention, and in fact where the original problem came from, lay in childhood. Now that's not to say that there's any blame in this. We're not talking about, oh, it must be the parents, the way they brought the kids up. Not at all. It's about seeing what's happened to that child and trying to correct it. And I think that addicts are born with a predisposition to sensitivity, which means that anything that happens to them will hurt them more than other people. Consequently, the feelings that are generated by that are greater, and the chance that they will do something to adapt themselves to suit that greater still.
So I guess really one of the big messages is that yes, you know, the addiction, the alcoholism, whether it's process or chemical, yes, we can treat that, but unless we treat everything, then there could be ongoing problems in the future. And I really love that. One of the things that I know our colleagues around the world uses animals as part of therapy. And I know you've got a great equine therapy program. You know, I know people who use elephants. One guy I know used wolves
Yes.
which I found fascinating, and dolphins, of course. We don't have many of those in London, so I'd like you to spend a bit of time talking about erection therapy.
Yeah, the idea of using an animal is that addicts usually have quite good brains. They can cognitively figure things out, but not emotionally. And the use of an animal is to access that part of the brain which is emotional as opposed to a thought process and cognitive. So horses, for instance, which is what we use, are limbic system perfect. They are feelings animal, not cognitive animals. They have no speech, they have very little sight, but they will pick up somebody's emotions from 100 yards away. I've seen it happen. So what we do is we get the patients in with a therapist and a horse expert, and we get them to do things with the horses which mean they have to access their limbic system, their emotional selves, otherwise it doesn't work. A horse will not do anything if it doesn't feel like it. So it forces patients to actually get into a different part of their brain.
It's a hugely powerful program, and I've seen it work with various people. Even one of my own family members has gone through that process, and I know it is a life-changing experience. I love what you guys do at 140, and the whole range of programs and facilities and different price points that you have to support the community at large. At Ark, I mean, we've worked with 140 for quite a while, and I'm always interested in how we can do better. How can we help you further?
I think simply by communication. You know, I think that this illness can only sort of thrive with a lack of communication. Because somebody said to me years ago that actually addiction cannot take place without the complicity of other people around them. And I believe that to be true. Now, I don't mean that they do it intentionally, but it does happen. So I think that the way that Ark and 140 can work together is to continue the dialogue, continue the process, because we will find a way of doing things which suits both of us. I'm absolutely certain about that.
I agree with everything you're saying, and to the point, and it's a nice kind of segue, because I know you've recently published a book, Who Says I'm an Addict, which we've got here, David Smallwood, Who Says I'm an Addict. I'd love to know several things. Why did you write it? And tell us about what goes on in it.
Okay, so what I wanted was to say to people, look, addiction is not about heroin. Addiction is not about alcohol. Addiction comes in people, not in pills, not in bottles, not in potions. And that it's the feelings inside and the trauma underneath that actually causing the problem. So I wanted to do a step-by-step guide, if you like, to tell people what each of those processes does and how to avoid the pitfalls, and as well as explaining where addiction came from. So there's a part in there about looking back 1 million years ago when we were living on the savannah in Africa, and we had very little in the way of cognitive ability, but lots of limbic ability. And the idea is that at that point in time, some people would have been very sensitive limbically. They would have been the watchers, the people who were the lookouts. And those lookouts, the generations following on, just as some people have blue eyes and some people have brown eyes, some people are more sensitive. That's the origin, that's where it comes from. So I wanted to put that in there, wanted to explain that, then the process of how that can end up causing trauma and then eventually causing addiction. And I wanted it in fairly simple language. I hope I've written it in language that people can understand. Because a lot of the stuff that therapists like me talk is jargon to other people, and I didn't want that. I wanted to be accessible to anybody.
David, you know, it's great meeting you again. It's great to see you. Thanks for spending time. This is Who Says I'm an Addict, and this is available now.
Yes.
Thanks, David.
Okay, thank you.